Practical specimens for CNS pathology. We would start with schwannoma. First specimen is microscopic picture of schwannoma. It shows a fibrillary tumor formed of Schwann cells having alternating areas of hypercellular and hypocellular or haphazardly arranged spindle cells. The hypercellular areas, as shown here, are formed of palisading or parallelly arranged spindle cells with wavy nuclei called Antony A. The Antony B areas are formed of those spindle cells but haphazardly arranged. Another picture for microscopic findings of schwannoma, showing here the characteristic palisading pattern of Antony A. The haphazardly arranged areas are called Antony B. A focus of the palisading pattern of the spindle cells or Schwann cells. Here, showing the parallelly or palisading arranged wavy nuclei of the spindle cells. The picture of the palisading pattern of the spindle cells is called verrucate body, formed of nuclear palisading, a nuclear area formed of fibrillary background, and another nuclear palisade. The second tumor is meningioma, which arises from the meningeal cells. This is a microscopic picture of meningioma, showing a well-circumscribed dural-based or dural-attached mass with firm, lobulated, grayish-white cut section. Here it shows brain compression. It doesn't or may infiltrate the brain. Another microscopic picture of the meningioma, a well-circumscribed dural-based or dural-attached mass compressing the brain matter. Microscopic picture of meningioma formed of whorls of meningothelial cells. Here the whorls are rarely or hardly separated from each other. Another picture for microscopic findings of meningioma formed of meningeal cells with whorly appearance or whorl pattern. Another microscopic picture of meningioma showing the whorly pattern or whorly arranged of meningeal cells. Here the so-called Samoma bodies. It starts as hyaline eosinophilic bodies and then become calcified. It's very characteristic to meningioma. Another microscopic picture of meningioma showing the whorly appearance of the meningothelial cells and the Samoma bodies scattered in between the whorls. Here it's a macroscopic or gross picture of extradural hemorrhage. It shows a clotted blood or a hemorrhagic mass outside the dura, so-called extradural hemorrhage. Macroscopic picture of intracerebral hemorrhage. Here it shows the hemorrhagic mass intracerebral. Macroscopic picture of pontine hemorrhage. It shows the hemorrhagic mass or the clotted blood inside the pons. Macroscopic picture of pilocytic astrocytoma of the cerebellum. It's a astrocytic tumor, grade WHO grade 1. It's a well-circumscribed mass with mucoid or cystic cut section and having a mural nodule. Here it arises from the cerebellum. Macroscopic picture of ependymoma. It's a tumor arises from the ependymal lining of the ventricles. Here it's a mass arising or filling the fourth ventricle, especially in children, and may encroach on the cerebellum. Macroscopic picture of glioblastoma multiforme. It appears here as an ill-defined mass arising in the cerebral hemisphere. Cut section is soft friable with areas of hemorrhage and necrosis. It's a very aggressive tumor, thus it's a WHO grade 4-1.